Nurse station, may I help you?
Come help it. Taking my mom. Come right
Okay, I'll be
away.
right there. What's going on?
They're taking my mom away.
But she's not even finished her treatment. Can't she at least finish her treatment? Hey, Roger 15, we're coming down with 5 people now. I'm so sorry. I'm so sorry. Hey, welcome to my channel. My name is Nurse Jumpin' Jackson. I talk about what my experience is like in the hospital as well as rebounding. I'm a fitness influencer as well. I've been a registered nurse for over 15 years, working from trauma floors to med surg. And one thing I hold sacred is this: hospitals should be safe spaces, not fear zones. And please don't forget that if you like my content, please subscribe, share, and comment below, because I want to hear what you got to say. How would you feel if your mother came to the hospital with a blood clot in her leg, was placed on a heparin drip to save her life, and then halfway through her care, she was pulled from her hospital bed? Not by doctors, but by immigration officers. This is the shit that's going on right now, that will be going on right now in Ohio. I shouldn't say is, probably already have, but this was going on. You're going to have undocumented people that's scared, in pain, but has trusted the medical staff, nurses, to explain what's going on with them, to help heal them. And then once they get stabilized or close to it, ICES come and just remove them.
Absolute 1,000,000% bullshit. Bullshit.
And then not to mention they may die in transit back to their country of origin. Because if they're leaving with a blood clot and or heparin, the clot can travel and they can end up with a pulmonary embolism and die. So how do you process that? How do I explain that as a nurse who took an oath to protect life? I can't, because it's foul, disgusting, and everything healthcare should not be. Here's an important fact. So in Ohio, hospitals there are being pressured to cooperate with ICES, not just morally, but financially. The federal government can threaten to pull Medicare funding if a hospital doesn't comply with immigration enforcement.
That bill would yank Medicaid and state grant funding from hospitals if they refuse to let ICE or other federal immigration agents inside their medical centers to serve an arrest warrant, interview people, or collect evidence.
This legislation is necessary to update our state's legal framework surrounding illegal immigration and ensure that our federal authorities are able to do their job.
Republican Representative Josh Williams from Sylvania discussed the proposal last week at a House committee hearing, saying the bill gives federal law agents the same power as state and local police inside a hospital.
I think it's very reasonable for ICE to have that same type of authority.
Klausya, who's been a U.S. citizen since the 90s, fearful immigrants will refuse to seek medical help if the bill passes.
What now? People will die in their house because they're scared.
It's not our intention to have ICE or any other federal agency remove an individual from the hospital if they need immediate medical care.
That bill.
So what happens? Fear takes priority over ethics. Hospitals quietly let ICES in. Bed starts emptying out. Families stop bringing their loved ones in. People die in silence, in fear, in preventable pain. And we nurses, CNAs, respiratory therapists, we're stuck in the middle. You think we came into this field to check immigration status, to watch patients we just stabilized get ripped away from treatment? So basically, you're going to have undocumented people dying from a system that valued borders more than their actual breath. If you work in healthcare, you need to ask your hospital, do we have a policy on ICES? Do we protect patient confidentiality? Do we notify patients when immigration is called? Because I promise you, it's going to happen. And the sad part, they're using Medicare money as a leash. But our ethics, our humanity, that can't be bought. We say we're healthcare heroes. Let's act like it. Because if we stand by while people die under our watch, the stethoscope might as well be a badge of silence. How would you feel knowing that ICES can remove any of your patients from a hospital bed, even if their treatment is not complete? Drop your thoughts below, whether you're a nurse, a family member, or just a human being. This affects us all. If you want to know more information about what's happening in Ohio hospitals, and how federal funding like Medicare is used to pressure hospitals into cooperating with ICES, check out the articles from below. We have the ACLU Ohio article, National Nurses United article, Ohio Immigrant Alliance article, or you can just search ICES in hospitals. And let me tell you, this is some fucked up and sad shit. Don't forget to subscribe. Have a good one.